I am Anne-Marie Green, joined by Vladimir Duthier, and of course we are in our home studios observing these social distancing guidelines. And we're going to start things off for you today in Washington, D.C., where yesterday's COVID-19 briefing really focused on whether or not the coronavirus would be returning by the fall. Weijia Jiang was there in that briefing, and Weijia, I mean, talk about sort of mixed messages. It definitely appeared as if the president wanted his experts to clearly say that the risk of the coronavirus coming back in the fall would be diminished somehow and controllable. It almost sort of seemed like he was sort of nudging them in one particular direction.
Yeah, we haven't seen Dr. Robert Redfield, the director of the CDC, for quite some time now. But yesterday, the president almost marched him out to the podium and called him up there to explain a quote that he gave the Washington Post, which essentially said that the next round of the coronavirus in the fall could be more difficult than the current one because it could coincide with the flu. Now, the president took specific issue with the headline of that story, which was that the CDC director said the second round could be devastating. Now, the president was right that the director did not use the word devastating, but ultimately when he did come to the podium, he said that he was not misquoted in the Post because the fact is, if you have to fight these two viruses at the same time, it could be a lot trickier. But even after that, the president was adamant in making his point that it might not return at all in the fall. And he said that several times, which led to an even more awkward moment when the nation's top infectious disease expert, Dr. Anthony Fauci, came to the podium and said he was confident that the coronavirus would be back in the fall. So you're seeing yet another chapter of tension play out between the president and his public health experts, even though Mr. Trump insists that he believes in science, he listens to science and his medical experts. Certainly critics say it only appears that he agrees and supports the science that he believes in, or the analysis that he believes in, rather than what his experts are saying sometimes. And the problem with that is it leads to a lot of mixed messaging, as you mentioned, to the American public. It leaves people confused about what to expect, what to anticipate, and what to do in the meantime. And by the way, if the virus does come back in the fall, it's hard to understand why the president seems to take a personal issue with that, as if it's his fault or something. I mean, you know, you almost wish he would just say, it could come back, but we'll be ready for it, instead of saying, you know, there's a good chance it doesn't come back at all, which is just not true.
Yeah, Weijia, we talked about this yesterday. We wondered if Dr. Redfield would be marched out in front of that podium to refute the interview that he had given to the Washington Post. And of course, kudos to the White House press corps, those of you who were sitting there, who got him to, in fact, say that what he had, the reporting from the Washington Post and the words that he had spoken to them were, in fact, accurate. There was another moment during that briefing yesterday, Weijia, when you asked the president specifically what he had to lose by using his full authority to expand testing and become the king of testing. And the president pushed back on that. What did he say to you about your question and the narrative around it?
He said he was already the king of testing, and said again that the country was testing more than anybody else, praising his administration for all that it had done. And I tried to point out several times that actually, when you look at the numbers, just 1.2% of the population here in the U.S. has been tested. And when you're talking about opening 100% of the country, is 1.2% really adequate? And why or why not does he believe that? He has made clear that he thinks it's great and they're right on track. But I think at the core of my question was still why he is not doing everything in his power to get supplies to the states that they need. We've talked about this a lot, but I don't think we can over talk about it, because the administration, the president in particular, likes to talk about testing capacity. And I mentioned specifically, that is not the same as implementation. So let's talk about implementation and what you need to do that. You need people, you need the tools, you need the equipment. And he sort of talked around that, and he tried to offer guarantees that he was doing a lot to help these states, and that it was the states' fault that but they didn't know all the supplies that they actually have on hand, so they need to do a better job of keeping track of that. And so he gave a long-winded message, but the bottom line of what he had to say was that he thinks that the country is in good shape and doing just fine when it comes to testing, even though let's remind our viewers that we're hearing the complete opposite from many governors.
I want to ask you about another part of the briefing that I think people may be scratching their heads about. So we know that Georgia is going to begin opening for business tomorrow, right? Certain businesses are going to be allowed to open. And the president has been a very outspoken supporter of moving forward with the economy, tweeting free, fill in the blank state, whatever state you want to choose. But then he was critical of the way, it's appeared that he was critical of the way Georgia is choosing to opening nail salons and hair salons and massage parlors. What do we make about that, the president's comments at yesterday's briefing?
I think it just puts on display this tug of war that he himself is feeling and that he is showing every day. Because on the one hand, he is so eager to reopen the country, to try to revive this economy that is hurting so badly. But on the other hand, he has an entire panel of experts, including public health experts, who are standing right next to him saying, okay, let's do this, but in a very methodical, categorical way that we have laid out for states. And so the problem is that Georgia is moving ahead into these other phases of reopening without meeting the criteria that it is supposed to before doing that. And so one of the main things is to have a downward spike of cases for the course of 2 weeks before you enter what's called phase 1 and start to reopen certain businesses. And it just hasn't done that. And the governor is defiant, and he says he's relying on his state data that shows that they are in a good position to do that. And so the president he has to support the federal guidelines that he himself laid out. And so that's why he is saying, I don't agree with this decision, but ultimately it's up to the governor. He did say that if he thought a governor was being egregious, he would step in, but didn't define what that meant. Because, if you're not going to step in when a state is ignoring the federal guidelines that are very clear, then when will you? And so I think it's just an example of the challenges he will continue to face as he tries to balance these two things of saving lives and saving livelihoods.
So, Weijia, on the subject of decisions, let's talk about that. Let's continue that discussion. On one hand, the doctor who was leading the effort by the United States to find a coronavirus vaccine, Dr. Richard Bright, says he was removed because of his resistance towards unproven treatments, as touted by President Trump. Meanwhile, Health and Human Services Secretary Alex Azar is now facing questions about another decision with regards to staffing. Somebody who has now been put in charge of his staff, chief of staff, who's, so is this true that his past experience was not in public health, but he was a Labradoodle breeder?
That is true. He was a Labradoodle breeder. He is a confidant of Secretary Azar's. He has had some other experience in the government, but he has been was tapped to lead the HHS response to the virus. And the secretary is defending that decision, saying that Brian Harrison, this aide of his, is demonstrating strong leadership when it comes to responding to this unprecedented public health emergency. And we have a lot more questions and requests in about why he's saying that. We want to know specifics about the leadership that he is presenting. We want to know exactly what he's doing. And, it raises a lot of questions because the president says many times since he got here to the White House that he only hires the best people. So is somebody who does not have a tremendous amount of public health experience, the best person to lead the HHS response to the virus? I don't know. If he is, then you got to tell us why. We do know he has extensive experience in dog breeding, but I just don't see how that leadership translates during a pandemic. With regard to the other position you were talking about, Dr. Rick Bright, yeah, he sent out this really clear, extensive statement that says him being moved from the position of leading the efforts to develop a vaccine was simply political retaliation because he refused to peddle the drugs chloroquine and hydroxychloroquine, which we know the president has promoted many times. But we should note that HHS responded to that part, at least, and said, look, Dr. Bright is actually the one who recently requested the emergency use of that drug. And so they don't understand why he's now saying he was so against it and saying that that's why he was, transferred to somewhere else. But I think, again, this just goes to the decision-making process, the who is doing what and why, and it does leave a lot of questions unanswered for the president, who didn't really chime in on either one, even though he was pressed about both during yesterday's briefing.
It's so true. So listen, Weijia, before I let you go, I got to ask you about this Paycheck protection program. Congress is supposed to vote today to refund that program. But, the first rollout was problematic. We saw a lot of smaller small businesses not get access to the money, while bigger small businesses were able to get millions. So I'm wondering what Congress is doing to ensure that the right businesses get access to this money.
So there is a chunk of that money set aside specifically for those smaller lenders and banks, $60 billion out of the approved $310 billion for those. But, we'll have to see if there are even more safeguards because this program received so much criticism. And we know there are already lawsuits against those big banks with plaintiffs alleging that they only took in large loans so they could bring in larger fees rather than help, these smaller mom and pop shops that don't have the same access to those big lines of credit. And so a lot of small businesses we know are still waiting to hear about the status of their application. They're still waiting for money. And, they're running out of hope because they can't pay the bills. And so, we'll have to really see the fine print to see if they're doing anything. But the president continues to offer assurances that those people who need the money will get it. So far, that hasn't happened.
All right, Weijia Jiang for us at the White House. Weijia, thank you very, very much for your reporting. As always, we appreciate it.